Okay, good morning. Bonjour et merci de vous être joints à nous aujourd'hui.
Good morning and thank you for coming today.
Health Week. I know the past weeks have been difficult for everyone. Let's remember to take care of ourselves and of each other. Let's remember that it's okay to ask for help and to feel sad and frustrated and alone. We are all in this together. And while we do need to practice physical distancing, we don't have to suffer alone. There is help out there for all of us. À tous les Canadiens, je sais que c'est un temps.
I know that these are difficult times for all Canadians. This is Mental Health Week. So let's remember to take care of ourselves. We can all ask for help, and it's okay to feel sad. We are all going to get through this together. No one should suffer alone.
We are going to hear from Canada's Chief Public Health Officer, Dr. Theresa Tam, the Deputy Chief Public Health Officer, Dr. Howard New, et le Président du Conseil du Trésor, Jean-Yves Duclos. Dr. Tam, please.
Good afternoon, bonjour à toutes et à tous. I will start with the latest numbers on COVID-19 in Canada. There are now 59,844 confirmed cases, including 3,766 deaths. To date, labs across Canada have tested over 919,000 people for COVID-19, with just over 6.5% of these testing positive. We are at the start of a new week, as we all inch closer to social and economic reopening. Most of us will be feeling the full gamut of emotions, from excited anticipation to nervous apprehension. All of these feelings are warranted, given the uncertainties that lay ahead. Still, there are continued signs that our efforts have slowed the growth of COVID-19 overall in Canada. In some places, the epidemic has been brought under good control, and the time is right for a cautious reopening. Other areas of the country may not be quite there yet, but will follow, guided by the careful assessment of public health authorities. During these many weeks, public health tools have helped us to tackle COVID-19 spread, buying us time to protect and bolster our healthcare capacity, ramp up research, and increase capacity for testing and tracing. Going forward, adapting these tools will be a big part of managing COVID-19 for the months ahead. No matter where we live, living with COVID-19 is something we all need to reconcile with. This means physical distancing, hand hygiene, and cough etiquette must continue everywhere. And although we'll be getting out of our homes more and more, it will be vitally important that at the slightest sign of symptoms, we stay home to save lives. Working while sick can no longer be a thing. As we move through the weeks ahead, let's not forget we are all in this together, and we'll work our way through it with good science, strong evidence, careful steps, and a shared goal to succeed despite the hardships. Together we can do hard things. Today is May the 4th, so may the 4th be with us. Que la force soit avec nous. Thank you.
Thank you, Dr. Tam. Dr. New, please.
Merci. Bon après-midi.
Thank you. Good afternoon. As usual, I'll start with the latest numbers on COVID-19 in Canada. There are now 59,844 confirmed cases, including 3,766 deaths. To date, labs across Canada have tested over 919 people for COVID-19, with over 6.5% of these testing positive. We're at the start of a new week, and as we all inch closer to social and economic reopening, most of us will be feeling the full gamut of emotions, from excited anticipation to nervous apprehension. All of these feelings are warranted, given the uncertainties that lie ahead. Still, there are continued signs that our efforts have slowed the growth of COVID-19 overall in Canada. In some places, the epidemic has been brought under good control, and the time is right for a cautious reopening. Other areas of the country may not be quite there yet, but will follow, guided by careful assessment of public health authorities. During these many weeks, public health tools have helped us to tackle COVID-19 spread, buying us time to protect and bolster our healthcare capacity, ramp up research, and increase capacity for testing and tracing. Going forward, adapting these tools will be a big part of managing COVID-19 for the months ahead. No matter where we are living with COVID-19 is something we will all need to reconcile. This means physical distancing, hand hygiene, and cough etiquette must continue everywhere. And although we'll be getting out of our homes more and more, it will be vitally important that at the slightest sign of symptoms, we stay home to save lives. Working while sick can no longer be a thing. As we move through the weeks ahead, let's not forget we are all in this together, and we will work our way through it with good science, strong evidence, careful steps, and a shared goal to succeed, despite the hardships. Together we can do hard things. May the 4th be with us.
Merci, Dr. Nou. Et maintenant...
Thank you, Dr. New. We'll now go to Jean-Yves Duclos, please. Well, thank you, Christia, and good afternoon, everyone. As you know, we're facing a global pandemic that requires global action when it comes to action and health. And that's why Prime Minister Trudeau made an important announcement this morning saying that Canada would continue to play an important role internationally, despite the issues that we are facing on the national front. There are some $800 million for testing, tracing, and vaccination in order to prepare for the production and distribution of products, treatments, vaccines that will protect us and help cure us from COVID-19.
Crisis at the international level, and that's why we also reacted, as we saw this morning with the Prime Minister, nationally and internationally. And with the health crisis has also come an economic crisis, and I would like briefly to summarize a few of the emergency response statistics that we have seen over the last few days. First, when it comes to helping workers through the Canada Emergency Response Benefit, a total of 7.3 million Canadians have received the CERB for a total of 10.6 million applications. Second, when it comes to providing help for wage subsidies, emergency wage subsidies, as of the 3rd of May, 96,000 applications have been made on the part of businesses, and a total of 1.7 million workers are being helped through the emergency wage subsidies. And finally, to help support our small businesses in this very difficult time, through the Canada Emergency Business Account, 518,000 businesses have applied and have received a positive response following their applications for the emergency business account, helping them go through the crisis in order that when the crisis is over, we can still rely on the great level of leadership and ability of our small businesses to grow again the economy. Thank you, Christia.
Okay. Merci, Jean-Yves. Et on est maintenant prêt.
Thank you, Jean-Yves. We're now ready to take your questions.
Minister of Health, Patty Hajdu, is here to answer questions as well. Carl, s'il vous plaît.
Thank you, Deputy Prime Minister. As usual, we'll start on the phone with 3 questions before we turn to the room. 1 question, 1 follow-up. Operator.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. We have a question from Laura Osmond from the Canadian Press. Please go ahead. The line is now open.
Good morning, ministers. For anyone who's able to answer, the Chinese embassy says the million masks from China that the Public Health Agency said couldn't be distributed last week were held up by a contractual dispute, and it's been resolved. Are you able to elaborate at all on what happened and what the status of those masks is now?
Hi, we'll have to get details back to you. I'm sorry, we don't have that technical information right now.
Laura, follow up?
Deputy Prime Minister Freeland, I was wondering if I could ask you a more political question. I'm wondering to what extent you're concerned about the rhetoric coming from your policy rivals, the Conservatives, and their refusal to express their confidence in the nation's top doctors.
Well, first of all, let me be clear about one thing, which is that to ever impugn the loyalty to Canada of a Canadian based on their racial or ethnic background or whether they were born in this country or immigrated here is completely unacceptable. A Canadian is a Canadian is a Canadian. And I am so confident that the overwhelming majority of Canadians understand and believe that. When it comes to the public health officers in Ottawa and across the country, I think Canada has been very well served by the dedication and the expertise and the collaboration of our public health officers across the country. And I think political leaders across the country have been really uniform in spending a lot of time with our public health officers, really working hard to understand their advice and to listen to their advice. And I think that has served Canada and Canadians very well.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Lynn Adib de la Presse canadienne.
The next question is from Lynn Adib, Canadian Press. Good morning, Mr. Duclos. I'd like to go back over the numbers you shared with us. They're very interesting. You talked about 7.3 million Canadians out of the 10.6 applications for the CERB. Were there rejections? You also talked about 1.7 million workers who received the wage subsidy. Are those people who Well, in fact, what I'm trying to do is see whether people are being transferred from one program to the other. Could you please give some additional details on those numbers? Well, going to the first question with respect to the emergency benefit, 7.3 million Canadians applied, made one or two applications, because the total number of applications is 10.6. And the applications that came in were approved. So the difference between the two numbers is that some people have received more than one payment. Now, as of April 11th, people could put in a new application in addition to the one that they had made initially. With respect to the wage subsidy, yes, 96,000 companies applied for salaries paid between March 15th and April 11th, so that covers 1.7 million workers. So 1.7 million workers who have no need to apply for the CERB. Follow-up question. So these aren't people who were transferred from one to the other. I had another question, a more technical one, with respect to the student emergency benefit. Now, we know that school calendars are different. In Quebec, they were supposed to be finishing in May. It'll be the end of May. So will CEGEP students, for example, receive the benefit for June, July, August? What about high school students who are heading off to university? Will they be eligible for July and August because their school year ends at the end of June? Answer. Well, to clarify, to add some clarity to the first question that you put, it all depends on the worker's circumstances. and one situation doesn't apply to all. So some may have received benefit under the CERB, then realized that the company they're working for would be paying out emergency wages. So then they would be reimbursing or have already reimbursed the amount they received because they are now receiving the wage subsidy. Now, with respect to the benefit for students, what's important is the time when they complete or finish their studies and when they would have normally started looking for a job. So for CEGEP, for example, in Quebec, it's different in Quebec because outside Quebec there are no CEGEPs, but once they finish their year and they would be looking for a job, that is when they would become eligible for the emergency benefit for students. With respect to secondary or high school students who have finished their year and plan to go on to post-secondary studies. Now, outside of Quebec, it's normally at the end of June that they would become eligible. And for university students, it is at the start of May. Thank you, Minister. We'll go to the operator for the next question.
Thank you. Merci. The next question is from Lauren Gardner from Politico. Please go ahead. The line is now open.
Thanks. This question is for Dr. Tam. You've talked a lot about the need for Canada to ramp up testing to 60,000 a day. And I'm wondering when you think that Canada can get to that point and what, until then, what needs to be done to get there?
I think there's increased testing, as you've seen, day over day. So I think the common goal is to increase that. 60,000 is just the capacity target for the provinces and territories based on the existing public health laboratory capacity. But we're investigating any other avenue for increasing lab testing, including point of care, and also the role of serologic testing when they do come on board. I think it's not a magic number, that is a capacity number. You do have to test the right people at the right place at the right time according to the epidemiology of the provinces. So they have to adapt their testing strategy based on what they're seeing. It's very different from a jurisdiction that have no cases and no community transmission. But there's increased testing, of course, being ramped up, for example, in Quebec, particularly in communities where there's been more reporting of cases. So I know that chief medical officers and provincial public health authorities are very seized with the need to use testing to inform the next stage. So I think we would expect to provide as much support as we can from the federal level to enable that to happen. So, but every day, as I think Ms. Haju will attest, we're constantly monitoring every bit of the supply chain, and every day there may be something that we need to tackle together. So that's just a sort of daily reality of the supply issue. But we're also tackling supplies from a domestic manufacturing ramp up as well. So I think a lot of those trajectories means that we can absolutely be increasing testing in Canada.
Follow up?
Yeah, my follow-up for the Deputy Prime Minister. I'm wondering kind of what is the next stage of Canada's engagement with the U.S. on COVID-19 response, just given looking at the large caseload and the differences between the states on what some are doing in terms of promoting physical distancing versus moving to reopen economies, and the impact that could have on Canada as we move further along and get further away from the immediate public health response. Do you have any thoughts about what might need to change in terms of Canada's collaboration or interactions with the U.S. on COVID?
So let me just start by commenting a little bit on the premise of the question, the idea that there would be a next stage. The reality is that the Canadian relationship with the United States is so close, and there is a connection and an interdependence on so many levels that this is a relationship that we are working on literally every day, even every hour, and not only at the federal level, The premiers are very engaged, particularly in working with the governors of their border states. Mayors are involved, business peoples are involved. So it's something that is happening every single day, every single hour, and that is exactly as it ought to be. And it's a relationship when it comes to coronavirus that has a lot of different aspects to it. There is obviously the border relationship, and I think that that is working out today very well for both countries. We have told Canadians, we've asked Canadians to stay at home, and it's been very neighborly to offer that same approach when it comes to our American neighbors. At the same time, essential travel is still happening, and that is happening really effectively. And that is so important for things like being sure that we have groceries in our grocery stores. We also have been working really effectively when it comes to the medical equipment supply chain. So this is an ongoing relationship. It is something that is a priority for any Canadian government, very much including this one. And it's going to develop as the situation with the coronavirus and on many other issues develops.
Merci, Madame la Vice-Première Ministre. We'll now turn to the room, starting with Julie Van Dusen from CBC.
Julie Van Dusen, CBC. I think it's for Theresa Tam or for Patty Hajdu. So President Trump says he believes that COVID-19 is the result of a horrible mistake in China, that he and Mike Pompeo have evidence that it originated in a Wuhan lab. What's the government's view? Where did it come from? How did it start?
Well, I'll start and I'll turn to Dr. Tam, as she's been actively involved in monitoring the illness since it first made its appearance back in December. There will be time, obviously, and a lot of interest and importance to understand how this virus became prevalent in the human species. And I think those questions are being asked, rightfully so. Certainly, the research and scientist community is all over it and trying to understand where the virus originated from and how it's evolved and mutated since it's been present in humans. But for me, as the Minister of Health, and certainly as the Government of Canada, although those questions are important because they will help us prevent future outbreaks and understand what we can learn from this particular virus. What's even more important right now is to stay focused on Canadians' health and helping Canadians get through the outbreak that we're in now, how we flatten the curve together, and how we protect and strengthen the health and social fabric of our communities. And so that's the work that I remain focused on. Dr. Tam, did you have anything further to add about your work?
Well, I don't think we've seen any specific information to say that this is a laboratory accident or release, but at the same time, we don't know the exact origins of this virus. Of course, the hypothesis is it comes from a reservoir like bats. It's very likely to have involved another animal somewhere in between the zoonotic or animal to human transmission. So that question hasn't actually been answered fully as yet. So I think there's a lot of work, including genetic analysis and more collection of animal and other data. There is international constructs with OIE, WHO, and others just to try and get to the bottom of the sort of where that zoonotic transmission occurs. So I think the natural history of the evolution of this virus will may be found in the upcoming months, but sometimes you actually might not find that until many months later. The SARS virus was the same thing. You had to sort of trace back, do a lot of sort of analysis in order to come up with a hypothesis. So I'm not sure that this is something that will be, immediately obvious, but work is continuing on that front.
Okay, so I didn't hear the words wet market, so it seems that it's not 100% clear where it came from. And on a similar kind of vein, it wasn't so long ago, and I guess the question is either for Theresa Tam or Patty Hajdu. It wasn't so long ago that the government said temperature taking was not reliable. There was no reason to take people's temperatures when they came into the country. That was maybe a couple of months ago. Now, Air Canada, you won't be able to get on a plane unless you have your temperature taken, you're wearing a mask. So I guess I'm wondering, Do you regret being so definitive, or is it just really hard to get your footing when it comes to this virus?
Well, it's a novel virus undergoes a lot of evolution in terms of knowledge, but the more you actually understand this virus, the more you begin to know that temperature taking is not effective at all. In terms of people coming across, even if you're infected, we know that the likelihood of picking up someone who's symptomatic is sort of relatively inefficient. And so temperature screening alone is not going to add to that. And if we had a significant number of asymptomatic or pre-symptomatic people, that also even reduces even the effectiveness even more. I think the most important aspect of our current response is to ensure that incoming travelers undergo the mandatory 14-day quarantine. So that within those 14 days, if you had a temperature, if you had any other symptoms, you can be safely managed and that you reduce spread to the rest of the population. So that is really the fundamental aspect of our border health response right now.
Thank you, Dr. Mr. Chase.
Hi, Stephen Chase, Globe and Mail. My question is for the Deputy Prime Minister. In 2017, your government famously said that you would welcome people from around the world, refugees who were fleeing persecution and other dangers. As we reported today, 46 Hong Kong residents who took part, many of whom took part in the massive demonstrations that began there last year, have now submitted claims for asylum in Canada. They're citing harassment by police and police brutality, and they're citing fears of unjust prosecution. Canada has a large and lengthy history of Cantonese immigration to Canada, and I wanted to ask you, is there a place for these protesters in Canada?
Well, thank you for your question, Steve. And on specific asylum claims, that's an issue that needs to be adjudicated very carefully and very thoughtfully, certainly not via press conference. But let me say about the Hong Kong Canadians that you're quite right, that Canada has benefited hugely from the immigration of people from Hong Kong to Canada. They contribute tremendously to our society. And I think all of us are very, very glad that so many people from Hong Kong have chosen to make their home and their lives here.
Just a follow-up question. I think one of the issues that's going to be debated more and more over the next few months and years, and I don't think these 46 are certainly the end of this, is does Hong Kong's political and legal system give rise to a possibility of a serious possibility of persecution? What are your thoughts on that?
Look, when it comes to Hong Kong, Canada's position is clear and very long-standing. We have supported consistently the one country, two systems policy. I made a number of statements about that as foreign minister, and Francois-Philippe Champagne, our foreign minister, has continued to be clear about that. And because of the large number of Canadians who live in Hong Kong, Canada does in the situation there.
Thank you, Deputy Prime Minister. Kevin?
Kevin Gallagher with CTV News. This is directed at the Deputy Prime Minister, but feel free to answer because it does have some other implications for the Health Minister, perhaps Dr. Tam. There was two more cell phone towers in Quebec that were burnt down. So there's one on Friday. There's concern that it links back to a conspiracy theory that the coronavirus is spread through 5G networks. The question, though, is how has misinformation that we have seen throughout this pandemic hindered or presented a challenge to get out effective public health information to people about this outbreak?
Well, I'll start, and then my colleagues may want to chip in as well. The incident to which you refer is, of course, regrettable, and there have been similar incidents in other countries, too. Of course, misinformation is especially dangerous at a time like this, when all of us are concerned, quite rightly, and when all of us change our behaviors and radically change the way our daily lives operate. So it's a time of both heightened anxiety and tremendous change. And so disinformation can have a particularly pernicious effect. We as a government are working very hard to push back against that disinformation. I think that's why all of us are here right now. And I would like to really also recognize the very important role the provinces and public health officials in. I do also want to say, I think Canadians have been great. Canadians are really smart. Canadians are really well informed. And while inevitably there are going to be individual moments where people fall prey to disinformation, by and large, I think as a country, people are making really smart decisions. And those smart decisions, those smart, well-informed decisions are saving lives. I don't know, Patty, Teresa, do you want to add anything?
Quickly say that I think it's quite normal during a period of such uncertainty and anxiety to look for answers. I think people want to know. I keep saying this. The question I hear in many different guises is, when will all this be over? You know, how did this happen and when will all this be over? And I think they're questions that, are top of mind for Canadians as they're stuck at home, as their livelihoods have changed, as they're so many mothers that I know parenting and trying to work at the same time, fathers too. The situation has changed tremendously for people, and that uncertainty drives, I think, a quest for knowledge or a quest for understanding. How did we get here and how do we get out? And that's why we've tried so diligently, not just through press conferences, but things like making sure we have the Canada COVID-19 app, that we disseminate information through the website, that we provide transparent information, that when we don't know, we say we don't know. And when we have new information, we present it quickly to the public. There is a whole field of communications called risk communications. Certainly, experts know that it's really important that you are available, for example, that you tell the truth, and that when you don't know the answer, you say you don't know the answer. And so we certainly try to continue to follow those principles so that Canadians can have confidence in our government, but also have confidence in what we keep saying, which is that we will get through this together as a country.
Just to follow up, and with provinces opening up businesses or loosening restrictions, there are concerns that as people start to get back to what would be more of a regular routine, that some of the new habits that have been picked up, physical distancing, for example, may become eroded as time goes on. So what are the main points that Canadians who are living in provinces that are starting to loosen restrictions need to keep in mind to keep themselves safe and to ensure the spread of the virus is as low as possible?
Well, I think the first thing Canadians need to remember is it's not over. It is a cautious reopening in certain provinces and certain sectors, but that the new normal will have to include new ways of living, new ways of working that will protect us in this unique and difficult time. As we suspect, I would say, a large portion of Canadians haven't been exposed to COVID-19. Which means that we don't have widespread immunity across the country. And we've done a really good job as Canadians holding the line, flattening the curve, reducing that transmission rate. But the continuation of that depends on us being extremely careful in with these new permissions from public health, that we can proceed to go back to work in certain settings, that we can proceed to go back to school in certain settings, but that we will have to follow the advice and guidance of public health nonetheless. And I think for governments, what that means is we'll need to repeat and provide that information in a variety of different ways. You'll probably see a lot more Government of Canada and provincial and territorial advertising about the importance to continue to wash your hands and to stay 2 meters apart and to cover your coughs appropriately and your cough into your sleeve and to most essentially not go to work or go to school if you're sick. And I think those messages you hear Dr. Tam repeat every day, they often are not, I think, what people want to hear. They want the magic solution, but the magic solution really is all of us continuing these practices that we've adopted and become somewhat used to over the last several months. Dr. Tam, did you want to add anything?
Yeah, it is going to be difficult, but I think keep on sustaining our messages about continuing the new things that you've learned, I think, in the last few months about personal hygienic practices, definitely staying home when you're sick, and practicing physical distancing. But I think the public does have to be supported to do so as well. So for businesses, we know that the province and territories are asking for very specific plans in terms of how do you restart certain, say, non-essential businesses safely so that the customers are also nudged into doing the right thing, like, how you pace the number of people in your store, or how you set things up so that people reduce the risk of transmission. Hand hygiene stations, in different places, as you've seen, I think will continue and needs to continue. But I think a lot of the creativity and the innovation that has actually occurred in the last several months, I think really needs to be capitalized. Some of the teleworking, telemedicine, and being able to access services in different ways will, I hope, continue. You need to build on the momentum of those innovations in order to help people adjust to this living with the virus. So you'll hear us in a very boring way repeating those messages again and again. Employers, of course, need to be able to support, and governments in helping people to stay home when they're sick. That is not an easy thing to do. That's probably the most difficult habit to sever. But people have to be able to do it with the support of their workplace or their schools or the environment that they are working on. And then, of course, we know about the issues that's characterize this epidemic, which consists of supporting those most vulnerable and in high-risk settings, and those must also continue as well. But I think Canadians have so far been great, and that with more reinforcement, they'll be able to continue to adjust and adapt. And I think it's just adapting and adjusting in a very slow way and cautious way is how public health is envisaging things. The other thing is the balance of physical and mental health and all the other dimensions as well, so that there are some habits that we may have had which was good for us and we diminish them. I certainly know I've exercised less, but sort of reigniting some of those preventive measures, I think, is very important.
Merci, docteur. On va maintenant retourner au téléphone pour 3 questions. Opérateur.
Thank you, Doctor. We'll go to the phone for 3 questions. The next question is from Émilie Bergeron. You have the floor. Question. Good afternoon. With respect to the production of a vaccine, a collection initiative was launched, and there will be a number of steps involved. Some will have access to it before others. Even though we want everyone to have access to it, there will have to be a priority order. How will we determine who has first access to the vaccine? Answer, Dr. New. Well, I think that before I answer your question about access, I think it's important to underscore the fact that with global cooperation, because research is being done everywhere and here in Canada, we will continue with research and in a spirit of sharing data with a view to developing a vaccine. Now, there are a number of technical aspects. People are saying that it will take between 12 and 18 months to do so. For scientists, I think, it's always based on the concept that the vaccine will be available for everyone worldwide. With respect to details on production, how it will be distributed, etc., those are issues that I can't answer now personally, but with good cooperation and collaboration across the world, we will come up with solutions to ensure that everyone who needs a vaccine, once we've developed a vaccine, will have access to it. Thank you. Follow-up question?
Go in English because maybe Minister Aidu can answer about this. Once a vaccine will be found by a country or the other, or different countries together, there will be countries who will have means to produce a certain quantity of vaccines faster than others. So I know that we are not there yet, but how are we planning this? There will be countries that will have access to the vaccine before others. How will that be determined?
You're right. In some ways, we're not there yet, but in other ways, we're preparing to be there for when a vaccine is created. And how we do that is, as Dr. New pointed out, we work together with countries so that the research is pooled and there's a collective, I suppose, shared ownership, if you will, of the findings of the research and the discovery of potential vaccine candidates. But also we're funding a number of Canadian companies who are doing research on vaccine, like Abcelera, which was part of the conversation or the announcement today, but looking at others as well as candidates for people that will not only be able to find the vaccine, but then produce the vaccine with their partners across the country. And all of that work is very important. It is almost like a race, but a race where you want everyone to be able to cross the finish line at once. And so we know, Canada, that as long as COVID is raging out of control in another country, Canadians will not be safe. And that's why the spirit of collaboration that Dr. New spoke about is so important, because yes, of course, every country wants to find a vaccine and vaccinate their citizens. But there will always be risk to every population if we don't consider the world health and the global health. And that's why I think it's so exciting to be part of an international effort, as well as the domestic support for companies and researchers that are working so hard here in Canada.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. The next question is from Jessica Murphy from BBC. Please go ahead.
Yes, hi. Thank you. I'm just wondering what you can tell me on a federal level, what's being done in terms of emergency preparedness. Obviously, we're already in flood season, as we saw with Fort Mac, but also, we're coming up on wildfire hurricane season. So what's being done amid this pandemic at the federal level for that preparedness?
That's a great question, Jessica, and it is something we are very, very focused on. Every spring, the Minister of Public Safety and Emergencies puts together a plan working with the Minister of Defense to respond to potential floods and forest fires. This year was no exception. And in fact, this year, those preparations have had the added element of a very deep appreciation that coronavirus would add. For example, when it comes to being really thoughtful about places where people who may need to leave a place where there is flooding or a place where there is a forest fire, having places where they can go. Obviously, this period of physical distancing means that we have to be particularly thoughtful about making provision for those kinds of things. But we are very aware that flood season and then forest fire season is upon us, and have been working very hard in collaboration with the provinces to be ready.
Follow up?
Yes, thank you. I do have a quick follow-up. I know in the U.S., for example, FEMA is looking at the complexities, for example, of getting people out of hospitals during this time and getting people out of long-term care facilities and that kind of thing. I wonder if there's anything specific that's being looked at in Canada in a similar way, any of the challenges or any things being looked at that level.
Sure, of course. I mean, the issue of what you do with housing people who may need to leave areas of flooding or forest fires is a really, really important one. And so, of course, is the issue of taking care of and moving people who are particularly vulnerable. So, for sure, that's part of the planning.
Thank you, Deputy Prime Minister. Operator, next question, please.
Thank you. The next question is from Marie Vastel, Le Devoir. La parole est à vous.
Oui, bonjour. Ma question est pour Madame.
Mary Vastel, Le Devoir. My question is for Ms. Freeland. I'd like to go back to the ban on assault weapons that the government announced on Friday. For months now, the government has talked about those weapons not being used for hunting. So why is there an exemption for an amnesty period for 2 years for Indigenous communities or people who are hunting? If you could comment on that. Answer. Thank you for the question. I think that our announcement on Friday was an historic moment. With respect to the exemption for Indigenous communities, it is an issue of constitutional rights for Indigenous peoples. I think that all Canadians understand that we must pay particular attention to that, including their right to subsistence hunting. And that is the reason why the exception was included. Thank you.
Marion Sully?
Ouais, sur un autre.
Follow-up question. Another question for you, Ms. Freeland. I'd like to know or to have an update on the negotiations with the provinces when it comes to bonuses for essential workers. For a month now, you've been discussing the issue with the provinces. There was a call with the provincial leaders at the end of last week. Did you reach an agreement? And if yes, can you tell us when the pay bonus will be paid by Ottawa to the provinces for essential workers? Answer. Another good question. Thank you. We have an agreement in principle between the federal government and the provinces. At the federal level, we understand that each province has specific measures. Some provinces have already provided a bonus to essential workers. We're continuing to work out the details, but that doesn't prevent the provinces from going forward. And the federal government is here to help the provinces. We feel that it is very important for Canadians, for people doing such important work. Many of the people doing these jobs are not well paid, and therefore it's very important to provide the additional support. Question. So there isn't an agreement then, if I understand what you're saying? Answer. I wouldn't say that. There is an agreement in principle, but for each province, it's an issue of working out the details. Thank you, Deputy Prime Minister.
Hello, Dr. Tam. So what are your thoughts on provinces? Some are doing really great, some are still struggling with the virus. So what are your thoughts about the provinces reopening, the ones that are having a harder time while the virus is still spreading around?
So I think with chief medical officers, we've established certain criteria, but they have to be applied within the context of the local epidemiology and what's going on. It's quite a complex decision, as you can imagine, balancing, of course, the fact that you need to have these cases under control. Your ICU has got to be at good capacity. but also that you have testing and contact tracing capacity in place. So it's quite complicated, and every area is going to be different. Even within a single province, you may have different situations. So that's the level of flexibility that is required, because what we don't want is to continually sort of close everything while, in that particular location, it may be safe to do so. So I think that is actually important, because there are actual potential negative consequences, of course, whether it be mental health or other issues. And I think my colleagues are very seized with that aspect as well, because if you don't return certain activities to a sort of living with COVID normal, then the consequences could be quite severe. Some of the key areas of initial reopening that they are considering, of course, is the non-urgent medical care. People getting outside, because transmission outdoors is less of a risk, but you try to maintain that 2-meter distance. So these are the kind of decisions that they're going through. But again, what I know for sure is everybody's going to be cautious about this. So slowly, carefully, see what happens, and then do the next step, I think, is a characteristic of all of the plans.
Okay, but what if and people become impatient with the COVID measure? They're free, and they want to just return to normal, and they throw those measures out the window. What happens then?
As to say, the province is going to be very careful. They have quite powerful local public health laws and guidance, and what they expect businesses, schools, workplaces to do. The moment they think something isn't going right, they're going to be readjusting. You're dialing up or down some of these measures. And so depending on how your population is adjusting, they're going to have to flexibly look at, well, do we need to tighten things up again? Mainly looking at the cases and the epidemiology for sure. So, and I do know that every community and its makeup might be quite different. So a very big city like Toronto might be quite different from a very small jurisdiction. But I think at the local level, they'll be watching very carefully. They can reinstate certain measures for sure if the things are not going well.
Thank you, Doctor. Ceci met fin à la conférence de presse. Merci.